Welcome to week 2 of Women's Wellness Wednesdays. This Golden Valley Health Center's project is funded in partnership with EMC Health Foundation. Remember, you can win a great women's wellness swag bag by sharing this content and tagging a woman you care about. Welcome to your 50s. Let's talk about how to help you live your healthiest life. The information provided in these slides is adapted from the Department of Health and Human Services Office on Women's Health. Not all of the information may apply to your life. Golden Valley Health Center's providers are available to help you get personalized health care. Call or text us at 866-682-4842 to schedule an appointment today. Let's talk about things that you can do each day to keep yourself healthy. You can choose to focus on one thing each day or work toward doing all of these steps. Eat healthy. Use the MyPlate plan to get started and go to choosemyplate.gov for more information. Get at least 30 minutes of physical activity each day and 7 to 9 hours of sleep each night. Reach and maintain a healthy weight. Get help to quit smoking or don't start smoking. Limit alcohol use to 1 drink or less, and don't use illegal drugs or misuse prescription drugs. Wear a helmet when riding a bike and wear protective gear for sports. And wear a seatbelt in cars and don't text and drive. There's also a lot that you could do to stay sexually healthy at any age. Limiting the number of sexual partners and using a condom each time you have sex are 2 great ways that people help protect their sexual health. Let's talk about information that may be important for you to share with your provider at your next Well Woman visit. A Well Woman visit is a yearly preventive checkup, and it's a great time to check in on how you're doing, how you'd like to be doing, and what changes you can make to reach your health goals. Some of the things you may want to talk about are menopause symptoms, such as hot flashes, vaginal dryness, or irregular periods. You may also want to talk about your weight, diet, and physical activity. Also, talk about whether you use tobacco, alcohol, or drugs, and any violence you're experiencing in your life. Please also talk about depression and any other mental health concerns. And please share your family health history, especially any risk of cancer, heart disease, and diabetes. And finally, please talk about your own unique story and share with your provider what makes you, you. At your next Well Woman visit, your provider may recommend the following tests, medications, or vaccines. Remember that the decision to get any medical test or procedure at any age is a personal one between you and your provider, and these recommendations may not apply to every person. Your provider may recommend that you have your blood pressure and cholesterol checked. Also may recommend that you be screened for colorectal cancer and diabetes. They also may recommend that you're screened for lung cancer if you're 55 or older and smoking currently, or if you've quit within the last 15 years. Your provider may also recommend that you be tested for osteoporosis, have a PAP and HPV test. It's also recommended that everyone have at least 1 HIV test during their life, and sexually transmitted disease testing may also be appropriate for you. Also, remember that you may be due for a mammogram and a test for tuberculosis. Medications your provider may recommend may help you manage any chronic diseases that you may have. They may also recommend that you take medications for urinary incontinence or a low-dose aspirin. There are a number of vaccines your provider may recommend, such as flu, hepatitis A and B, measles, mumps, and rubella, meningitis, shingles, and tetanus, diphtheria, and whooping cough. Check out our other videos this week for women of all ages. Remember, you can win a great women's wellness swag bag by sharing this content and tagging a woman you care about. Schedule your appointment today by calling or texting 866-682-4842, and thanks again to our partners at EMC Health Foundation.